Now we will show how to perform the treatment using the HIFU device. Firstly, we need to ask the patient to sign the informed consent, and inform them about the contraindications and precautions after the surgery. Next, we can remove the patient's makeup, and clean their skin. Before the treatment, we need to take photos of the patient's face from the front, side, and 90-degree angles. During the preparation for the treatment, we can let the patient sit up for better access to the face. Then, we can start drawing energy areas on the patient's face. It is important to draw the lines to avoid sensitive nerves since our HIFU technology can reach the deepest fascia layer of the skin. We can prepare a special ruler in advance for soft skin. Firstly, we will draw the restricted area, starting with the marginal mandibular nerve, which is located at the corner of the patient's mouth. We need to draw a line which interval distance from the corner of the mouth is approximately 1.5 centimeters away, about the width of one finger. And draw a line along the highest point of the lip peak perpendicular to this line. Please note that the 3mm and 4.5mm HIFU cartridges should not be used in this area. It is important not to operate directly on the mandible during the treatment, and we can lift the patient's face up during the treatment. The second area is the ear temporal nerve, which is located in our tragus. We should draw a vertical line about 1.5 centimeters away from the tragus. It is not recommended to use 3mm, 4.5mm and 1.5mm HIFU cartridges in this area. The third area is the orbital bone region with the superficial temporal nerve, where we can touch the bone under the patient's eyes, and draw an arc along this bone. However, we are not allowed to operate within the orbital bone. The fourth area involves drawing a line from T corner of our eye to the hairline. Placing a point at the end of our eyebrows, and then drawing another point 2.5 centimeters above this line, which is about the width of a ruler. Finally, we connect these 2 points. The superficial temporal nerve area is located at a 45-degree upward angle from this line, and it is prohibited to operate within this region. The fifth area pertains to the superior hip nerve. To identify this area, we should ask the patient to open their eyes, and see the point of eyeball. We draw a point on the eyebrow corresponding to the midpoint of the eyeball, and connect the line to the hairline. The superior hip nerve area is located in the middle of the forehead, and we must not use with 3mm and 4.5mm cartridges in this area. So these 5 areas are restricted for the operation, and we must avoid them during the procedure. For the part of jaw, we can use 1.5mm cartridges to perform the treatment, but it is not recommended to operate on the area next to the corner of our mouth with 1.5mm cartridges. In the ear temporal nerve area, and within the orbital bone, it is not recommended to operate with 1.5mm cartridges. However, 1.5mm cartridges can be used in other areas. In addition, at a position of a 45-degree angle, which is the ear temporal nerve, it is not recommended to use 1.5mm cartridges. Also, in the position from the midpoint of our eyeball to the brow, it is not recommended to use 1.5mm cartridges. But at the center of the forehead, 1.5mm cartridges can be used for treatment. After marking the restricted areas, we need to draw auxiliary lines to facilitate our operations. It is very convenient to operate according to the drawn grid during the operation. To begin with, we can draw the first auxiliary line. We need to mark a point on the side of our nose, another point on the highest point of the cheekbones, and a point on the tragus. Finally, connect these 3 points. The purpose of drawing this line is to determine the position for operating with the 4.5mm cartridge. The 4.5mm cartridge is recommended to be operated below this line but not above it. This is because the soft tissue of the skin above this line is relatively less, and the depth of 4.5mm is too deep for the skin to tolerate. After drawing the dividing line, we can use the treatment cartridges to draw the auxiliary lines. Now, let's discuss where the treatment cartridge emits energy. We can see that there are two vertical lines on the treatment cartridge. In fact, the energy emission position is within the area between the two vertical lines, not in the entire black area, where energy will be emitted. At this position of the cartridge, we can see that there are E3 lines here, so the emitted energy position is within the area of the width of these 3 lines. Therefore, when we draw lines, we need to draw grids based on these 2 lines and 3 lines above the treatment cartridge. Let's start with drawing the auxiliary lines. First of all, we use the length of the 2 lines of the treatment cartridge to mark the points. The distance between the points is the same as the length of the lines on the treatment cartridge. When drawing upward, we use the length of the 3 lines of the treatment cartridge to mark the points. After drawing, we connect the points with a ruler. We can also use the treatment cartridge to assist in drawing lines on the forehead. Now let's demonstrate how to draw lines for double chin treatment. First, we draw a point in the middle of the jaw, and then we can palpate the mandible of the patient, and draw a point on both sides. Finally, we connect these 3 points to form a triangle area, which is the double chin area we can treat. Generally, double chin treatment is recommended to be done with the 4.5 mm cartridge. Therefore, we also use this treatment cartridge to draw auxiliary lines at fixed points. We can operate from the middle to both sides by stamping, and after finishing the first treatment, operate from bottom to top again. However, if the patient is particularly sensitive to pain, we can change the treatment cartridge to 3 mm and operate it from bottom to top. It is better to use the 4.5 mm cartridge for double chin treatment because this area has a lot of fat. Before the treatment, we should apply cooling gel. Please note that there is a thyroid cartilage in the middle, which should be avoided during the treatment. The treatment cartridge should touch the skin closely and operated vertically. If the patient only gets treatment for the double chin, it's better to treat the cheeks and neck as well. Because when our jawline goes up, the neck skin goes down and then the patient's jawline will be very clear. If we only treat the double chin without treating the cheek, which is loose, the effect of this jawline will not be obvious.